Welcome back, everyone. I hope the conversations you've been enjoying in your breakout sessions were as rich as the ones that I attended. They were excellent. It's been an awesome afternoon so far. In my work at the Alliance for Healthier Communities, I work with some pretty competent and skilled people. And one of the benefits of being a manager is you can delegate. So I get to delegate to my colleague, Simeon Kanev, who is our privacy business lead at the Alliance for Healthier Communities. He's going to facilitate the next panel. So over to you, Simeon.
Thank you, Rod. Wow, what a day it has been. And we're going to conclude day one of the PHIPA Summit with a fantastic presentation, a fantastic discussion. My name is Simeon Kanev. I'm the privacy business lead at the Alliance for Healthier Communities, and we're also the honorary host for this year's event, which we're very proud of. And I'm also on the advisory board of this summit as well. So I get the pleasure to help out as much as I can, and also to moderate this fantastic panel that we have summoned here for you. And the topic that we're going to discuss isn't really going to be the stock surge of GameStop, nor it will be anything about Bitcoin. Well, or Bitcoin's volatility, but when one thinks about it, maybe it was ransomware that made Bitcoin, as highly priced as it was, at least in the early stages. But this is the topic we're going to talk about, and it was worded ransomware, the pandemic within the pandemic. And I think this is a very suitable title for this topic because, believe it or not, ransomware is not new, and I'm sure many of you know that. It's been there for quite some time. However, in the last 3-4 years, it's really been at the forefront of everybody, specifically anybody in the cybersecurity field, in the privacy field, compliance field altogether, because it has been quite a challenge to tackle. And I recently read a joke about ransomware. The public asks, why couldn't they catch the hackers? And the answer of the law enforcement was because they ransomware. And I thought it was hilarious. It took me some time to realize what actually meant by ransomware, but indeed, it seems that they're eluding or they're very, stay elusive to being caught for whatever reason. And the other problem to that, I guess, is the fact that lots of victims pay, therefore fueling the whole thing. But I'm going to stop it here because I really want to introduce our panel of various team speakers here. And I'm going to just mention their names and where they come from, and I'll give them the opportunity to tell you more about their backgrounds and where they come from and what their perspective is going to be. So first of all, I would like to introduce Jennifer Zellmer, who is from the Canadian Foundation for Healthcare Improvement. Jennifer, please wave. Thank you. Then we have Greg Singleton from the Health Sector Cybersecurity Coordination Center, or HC3. Hi, Greg. And then last but not least, we have Brad Hines, who also goes by the name Renderman, who will have the pleasure as well of being here. And this is where I would like to give you the opportunity to present yourself briefly and tell us, our audience, what is it that they need to know about you. Let's start with Jennifer.
Thanks so much. So I think the first thing that may be helpful is that I'm joining you today from Ottawa, the traditional unceded territory of the Algonquin Anishinaabe people. And I'm so grateful to have the opportunity both to live, work, and play in this place, and also through this virtual means to be able to continue traditions of gathering and of exchange. So as Simeon said, I work for the newly amalgamated organization that brings together the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute. And so both national not-for-profit organizations that are focused on how do we shape the future of patient safety and quality in Canada. And so cybersecurity matters a lot to us from that perspective. And in my previous life, I was also involved with efforts that Healthcare Can led around Coalition for Cybersecurity in the Health Sector.
Thank you, Jennifer. Greg?
Yes, thank you, Simeon, and thank you to Rod, Dustin, and the PHIPA folks for inviting me to join. So I'm joining you from a little bit south of the border. So I'm with the United States government, Department of Health and Human Services. I had the opportunity to come over a few years ago to Health and Human Services and start up this office, this Health Sector Cybersecurity Coordination Center, with the recognition as we saw these threats emerging and cyber threats emerging and taking a toll on the sector, there really identified a need for more of a belly button of information sharing and coordination for the government and the sector's purposes, so we can identify, what's going on across the sector, what are the needs, what are the challenges that people are facing, and then how do we, either leverage governmental resources or just information resources and get things digested in really easy to comprehend way, so that people can understand what's going on out there. I mean, at least from my perspective, a lot of cyber challenges, they're kind of technical challenges, but they're also really information management challenges. Understanding what's actually happening, and you look at the most recent threat out there, and I can download hundreds of technical pages on details and indicators and IPs and other stuff, but understanding that's a real challenge. And so we come at this stuff from the perspective trying to help people understand and get actionable information that they can really leverage to help protect themselves and protect our nation and allies a little bit better. I think a little bit about me. Oddly, I'm a 10-year veteran of the U.S. government at this point. Previously worked with Department of Energy, setting the foundations for some of our energy policy work in some prior administrations. And, I really just keep finding interesting things to do. Odd thing that I've had to do in my career is after the Fukushima Daiichi reactor accident, we loaned some drones and material to the Japanese government to try to help understand the situation and respond to the emergency. And all of a sudden the question came to us was, do you guys want it back? And we said, no, we don't want that stuff back. But how do we write that off and say we don't want it back? And it's kind of like the crazy challenges you face in the government with the good work that we do to help the citizens and our allies. So thank you. Glad to be here.
Thank you, Greg. Glad to have you here. And Brad, you want to introduce yourself briefly?
Greetings. I'm Renderman. Done a few, just more than a few privacy conferences in years past. It's nice to be back. I get paid to break stuff, so I'm coming at this discussion very much from the trenches. A person who's on the ground, sees the problems and everything, and has to try to then explain to management, why all their customer information is now on the dark web, or why everything's encrypted. It's a different side to my colleagues here, and I don't know. It's a scary world out there, and I'm one of those strange people that tends to run towards disasters, even if I sometimes cause them. But yeah, if people knew everything that I knew, they'd be in a corner crying. It takes a special kind of person to see the situation that we're in and still get up and try to make a difference. So hopefully I can do some of that today.
Thank you, Renderman. Sometimes I wonder, perhaps it will be easier just to go some cave in some desolated place and just live there. But unfortunately, that's not how the world works, or at least not our world. Now, there is one more introduction I need to make, and I need to introduce our audience to our speakers, because you really need to know the audience that you're addressing, considering who comes to the PHIPA Summit and who watches this. And that audience consists of many representatives of organizations. And the bulk of those organizations, if not all of them, are rather small organizations that do not have huge budgets to pay for the latest and greatest when it comes to technology. Surprise, surprise, unfortunately, in Canada, we do not really have, healthcare is not for profit. So we rely on funding. And unfortunately, the funding is not always there, if ever. You ask an IT specialist, do you have everything that you need? Well, I don't think there is always going to be one in this country that would say, yes, I do. So this is who is in our audience, people that really don't have much. And if they have limited budget, they're lucky, because some others have no budget whatsoever. So we really hope that you will do that, and you will address and put actionable items forward that they can take and use in some way or form. And by the way, before I forget, please put any questions in the chat box. We'll definitely make sure that we tackle them before the end of the presentation. Now, this is where I would like you to start. we mentioned that ransomware has been there for quite some time. It's nothing new. However, it's still at the forefront for many people. And it is called ransomware, the pandemic within the pandemic, but I think that can spread across all cyber attacks. And we know that things have gone really, really bad with COVID. Now, in terms of kind of like preparedness, I think that's an important topic to address and to touch on. What do you think is the state of preparedness for the organization, specifically in the healthcare sector, when it comes to ransomware? Do you think they're anywhere near, I don't know, like at the forefront? Do you think there is somewhere in the middle? What is the state of preparedness for organizations in this day and age after 4 or 5 years of ransomware being on the headlines? So let's start with Greg.
Sure. It's an interesting question on the notion of preparedness, and we have to recognize the differentiated levels of capability within the sector, certainly within the United States, but elsewhere as well. We have our big players that are much better equipped, much better funded, and we have medium-sized entities and then small entities. And so there's going to be different levels, but really, I don't know anyone in the sector that hasn't heard of ransomware, isn't concerned about it, and hasn't at least taken some initial steps to say, well, what can I do about that and how can I approach it? Even if it's just looking at their insurance policy coverage or other approaches. So if you ask me on preparedness, I think the sector is better equipped or becoming better equipped than some other sectors that we see in terms of critical infrastructure, really recognizing the challenges, discussing it, discussing the issues and saying, okay, what can we do about it and how can we approach it? But the sector is still heavily targeted because it is, it's a sector with a lot of resources and money and funding, and it's really more than that. It's a critical sector to the nation. Like it's unthinkable that we would let these entities stop operating. So then the pressure for them to pay the ransom is greater, which leads the bad guys to target the sector because it's more profitable for them. So, I don't want to say that the sector is behind or ahead in preparedness, but they are a ripe target that the bad actors are seeking to exploit so they can maximize their payouts. And I think that's part of what we see going on.
Thank you. Renderman, you would like to continue?
What's the phrase? The Army's always preparing for the last war that they fought. You're saying that people are more prepared. They're dealing with starting to get the controls in place and everything is set up for this. Yeah, but there's stuff down the road that we haven't necessarily seen yet that they're going to get blindsided by, and we're going to be back to square one. Because I think a lot of the problems are very, you say, are they in the front, these priorities in the front seat or the back seat, well, somewhere between the back of the bus and under it. Because, so many of the problems, and it's not, speaking to these small and medium organizations, it's not about the money. It's not whether or not you have this $100,000 box in a rack that, decides whether or not it protects you or not. It's how is it configured? Simple things like asset management, knowing what's on your network. So many places I run into, and I heard on one of the earlier sessions where, there's a random box in a corner that, filled with old laptops and stuff, or some old server that people forgot about, or a test instance that, because everybody's being run off their feet, and they're making their pitches for these expensive boxes, they're not looking at the stuff that should have been decommissioned and, killed with fire a long time ago. And I think you'll find with most of the ransomware situations, that was your entry point, was some neglected system that was probably well past end of life. And so it's like, you don't necessarily need to spend more money. You just need to spend the time you have more wisely.
Okay, thank you. Jennifer?
Yeah, so maybe just picking up where you left off, Renderman, I think, during the pandemic, time has been at a premium. And so in that environment where we've both upped the use of digital systems because virtual care has increased significantly. We've had to change the ways that we work, and there's been more reliance on virtual tools. Our time crunch is such that it's been difficult to keep up with the basics of cyber hygiene as well. So you do have a bit of that combination of perfect storm. And to your point, Greg, I think there's quite a variety actually of levels of preparedness. There are some organizations that have invested a fair bit of time and money over a period of time to build that up, do the audits of their network, do some of those core pieces. And there are others for whom this just hasn't been front burner. And so,
or
at a
others
different
that spend a lot of time preparing for who to blame.
Well, there's a whole bunch of reasons why you might end up in that situation. The latest survey that I'm aware of, and this is pre-pandemic, more than 80% of Canadian healthcare organizations said that they'd either had a breach or they'd narrowly avoided one. So, we're definitely in a situation, to your point, Greg, of health sector is a target. And so it's an environment we need to be aware of and thinking about.
But interestingly, there was actually a couple of cases, I believe in the UK, where ransomware infected a hospital, and in the negotiations, they were able to prove, hey, we're a hospital, pandemic, problems. And the bad guys were like, oh, sorry, here's the key. Like, they have a heart too, which is very interesting in and of itself.
Yeah, I mean, it depends. In a tiny heart, because I think it was it GandCrab operators said, we're not going to target medical sector. A few of them kind of specifically said, well, okay, pandemic. And really, it's not so much they have a heart. They don't want the police and really, really fierce people with bigger weapons coming after them because this is a pandemic. And so a few of the groups said, no, we're not going to target the medical sector. But they ended up, I think, accidentally, or in the end, they're like, this pandemic's lasting longer than we thought. We want to make money again. And, I don't know that their word was really worth all that much in that case.
Still, it's just to clarify that it's not always heavily targeted.
Fair enough.
Good point. Good point. I just wanted, because Dustin asked me, like, you probably should show this, and I hope it will show. What we typically explain, I apologize, it's in black and white, but this is a herd of gazelles running away from a predator. Okay, and the way we explain it is, you don't, like, all you need to do is try to be somewhere in the middle here, right? You want to be basically the strength in numbers. You don't want to be this one at the front, sorry, here, because if the herd behind you suddenly veers off, you'll be singled out, and you don't know whether you're heading the right way. You certainly don't want to be the one at the end, just be the last one in the pack, because you'll be eaten alive. And I think we agree on the fact that hackers are lazy. They go after the easiest target.
Hey, I resemble that remark.
I'm glad he said that. I usually want to say that, but they're efficient. If you want to be nice about it, say they're efficient, not necessarily lazy. But
not necessarily lazy, but if they have the choice going after the easier target, I would say probably reasonable to say that they would go after the easier target, where they would spend less time. I would guess. Now, Greg, I think you pointed out on something important. I think all of you actually touched on something important, which had to do with the fact that COVID in the pandemic, things changed a little bit. Did the pandemic exacerbate the problem further than what it was before? And if yes, in what way? And if anybody wants to start on this.
Yeah, no, I'll take that. And I mean, it exacerbated the problem in the notion of its stress upon the system. So you can think of all these things as, from a kind of geopolitical sense, stress on the function of our nations and critical sectors and health sectors. So, COVID, when I think of kind of what we've been through with COVID on this, all of a sudden COVID became a hot topic, and we saw all these COVID-themed lures and malicious actors trying to leverage COVID to continue doing the things they were doing. Then we saw folks explicitly targeting the sector in some cases, targeting the government departments and other elements to try to kind of harass and continue to kind of degrade and just add stress to the sector. And then it turns out the whole health sector, this is our job to fix this thing in terms of COVID. So now we're under stress from that stuff as well. So I think of it as, additional stress on the systems and additional stress on kind of the workforce. I do think it changed a little bit in terms of everyone going remotely and, you know, more presence in front of screens, more likelihood to click on stuff, more, you know, vulnerability to certain lures. But, you know, we didn't see, despite all the fear of, you know, someone hacking into the Zoom call and Zoom bombing, which, you know, happened at the outset, I didn't see the teleworking stuff explicitly causing an increase in attacks or vulnerabilities, but certainly just the general remote nature of the work and the remote connectedness, everyone going in through VPNs, certainly contributed to increase kind of attack surfaces, if you will, for folks to exploit.
Thank you. Jennifer Renderman, if you want to.
I mean, certainly there's been formal warnings here about the increase in the number of attacks targeting the health sector. And, you know, that can be for during the pandemic, and that can be for a variety of reasons. You know, the value proposition has changed in some case. You've actually made my heart warm, Renderman, that sometimes you can also, you know, do an appeal to sanity, and everyone's better angels. But I think, you know, the attacks are up overall. And I also think the reality is that, particularly at the beginning of the pandemic, the situation's a bit different now. Lots of people had to implement a lot of virtual solutions very quickly. And in some cases, those virtual solutions came from larger companies who had the capacity through a cloud-based solution to put some protections around it. And in some cases, they were done off the side of somebody's desk and created that, what did you call it, the bag of laptops, the old bag of laptops, that might be the equivalent in the corner. And so there is some work to do because of just the very real situations that people faced. There's also been a number of healthcare organizations that weren't previously wired for patient use that have opened up for patient use in order to enable virtual visits between patients and essential care partners, including family members. And so there's more accesses to networks in some cases. So the risk profile has just changed somewhat in terms of, you know, what's happened in the course of the pandemic.
Yeah, I think that one thing I got to do is I got to shout out to all the IT people during this whole pandemic and schmoz, because literally some of them over the span of a weekend, you know, you had all these companies and organizations that were like, no remote, you have to have a, you know, button a seat in an office and everything like that. Then they're like, oh crap, you know, we got to go remote. They had no, you know, stable VPN solution, you know, didn't have any laptops or anything like that. So they had to, you know, scrounge up laptops, get them set up an image, set up a VPN solution, literally in a weekend. The fact they got anything done and the pothole in the highway was actually relatively small for the disruption. You know, I mean, there's still some adaptation and everything. The problem is that a lot of this, as you said, were off the side of somebody's desk. They were, you know, spit and twine held together, you know, by hope and a prayer. That a lot of organizations were like, oh, great, you know, now we're set up for remote. Yeah, we need to go back and fix this because it's about to catch fire. But they're like, but it's working, right? Yeah, but it's going to catch fire. But it's working, so why spend the money? Yeah, there is the problem I'm seeing now, is a lot of this stuff that was set up in haste, you can't, you know, they haven't been given the opportunity to go back and do it properly, as opposed to just, you know, get it working. And I think that's where a lot of your opportunities to, you know, as you say, increase the risk surface are. But the other thing too is that things like Zoom, a lot of the problems there were because the company hadn't expected to now suddenly be an essential service. They were still having some growing pains with their software, things they hadn't, you know, they hadn't expected to be used for, like, you know, parliamentary cabinet meetings. And so, yeah, they didn't have things like the lobbies, and they hadn't really done any sort of education to tell people, don't post the meeting number when you're tweeting out a screenshot or things like that, like Boris Johnson did. So I think there's also a user element too, that these new solutions, people need to understand what to do, what not to do, what to click on, what not to, particularly what not to click on. But I think that the benefits that have been created from this by pushing a lot of these organizations that were previously like, no, remote's bad. We have to be able to see, the patient in front of us. It's like, well, when I'm trying to just get a refill on a prescription and I need to, talk to my physician, do I blow a couple hours in an afternoon and sit in a waiting room to talk to him for 10 minutes to get the script? Or is a 10-minute phone call? It's so much more convenient for both of us, which allows them to see more patients, for these kind of routine things. There's a huge benefit there. And I hope that's the sort of stuff that sticks around after this.
Renderman, you actually touched on a great point, because it ties to a question that just came in, which has to do with clients, patients want information delivered easily, seamlessly, without the hassle of encryption and whatnot, while the providers on the other end are trying to be compliant and trying to protect those. So it's kind of like, weird on both sides, the way they're striving to do this. So basically the question asked is, how do we balance the need to protect methods of communication and data storage with the patient expectations in mind, considering the environment we live in? So
how many people, say, oh, I wish I didn't have to, do all this sign-in stuff. I wish I didn't have to deal with encryption and also, it's like, who's going to care about my medical records? It's like, well, do you wear clothes at home? Now, obviously, there's a certain percentage that don't. I'm not shaming them or anything, but yeah, you don't have anything to hide, but you don't have everything to share either. You are aware that there are windows into your home. You don't walk past a window naked, or if you do, like, you're probably going to get a ticket or something. But people need to understand that there is a base level of security that is necessary. But I think on the InfoSec side, on my side of things, we have done a very poor job sometimes in the implementation to make it easy for the users, to the point where they will find their ways around things. You're always hearing about the secretary or somebody that's figured out a way to bypass all this stuff because they're asked to do a job. And the security thing is an impediment. And they'll find some way around it that undermines everything. But I think there's also a certain amount of hubris too, particularly when you're talking with physicians, where they've gone through all these years of school. They're saving lives. This is very important. If I have to spend a half a second typing in a 4-character PIN on my iPad to access a medical chart, that's gonna take that's gonna cost so many lives and everything. And it's like, dude, you're a podiatrist. Like, or a proctologist or something like that. We're not talking like super serious stuff. We can make accommodations for the, incredibly emergency situations, but basic controls can be very seamless and very transparent.
Jennifer, Greg, if you want to tackle that.
Well, I think that is part of the challenge, right? How do we make the right thing to do the easy thing to do, so that we're building in the capacity, so that you don't have those 10 steps that you were talking about, but we find ways of designing for security, designing it in,
and also engineering away stupidity.
That too, and providing that support, right? So that as we are implementing new approaches to virtual care, because all of us want effective and appropriate virtual care to be part of the future of the health sector, for it just to be care, right? So how, as we do that, do we build in that the right thing to do is the easy thing to do?
Okay, so here is a situation that we'd like to throw your way to see, what way would you take it? And just a kind of hypothetical situation. So you're the person in charge of a small to medium healthcare provider. A ransomware attack has successfully spread throughout the organization, and to make their point very clear, the malicious actors are threatening to publish the health information of 1,000 people on the web every hour until you pay, which suggests quite likely that they probably exfiltrated some information out. What would you do?
Well, I mean, so I'll start on this one, and then I'll let my colleagues correct me where I'm wrong. But I mean, what it first is, it's the wrong time to ask me, because hopefully as a leader, I've asked myself this question yesterday and the day before and a month before and 2 months before and 6 months before. And so we have our plans in place at that point to where, yeah, this is, I mean, where ultimately I want to see people get to with ransomware is to the point where it's a nuisance and not a frightening, scary, major impediment. And so you want people to have those offline backup systems in place, systems that rely on, one-time write capabilities or other things that are stable and reproducible and recoverable, really. I also want to make sure that we've looked at our perimeter. Renderman talked about just your asset inventory, but understanding your perimeter and what your systems look like from the outside, and ensuring that you've taken those initial steps to reduce the likelihood that you even get to this place where you're faced with this situation. But supposing, because we are all human and the email training fails, someone clicked that link and then they got into the system. Again, I'm hoping I've got backups and I'm maybe losing a few hours or 3 days of data and it's recoverable. And then this becomes a blip in the organizational evolution and the story of the year, and it's just like, yeah, we had that and we recovered and we were okay. I don't think ransomware is ever going to go away in the way that it's going to be solved. But I like to think of the example of bank robberies, and I'm sorry, I'm going to have to use data from the United States, but bank robberies they're bad, but they're not something that people fear and are terrified of. And the last year that the FBI published data, I think there was like $34 million stolen in bank robberies in the United States in the year, because we've taken proactive steps, limited the amount of cash in drawers, we've got cameras everywhere, we've got ways to track it down. And ultimately, I don't know that we're going to get rid of ransomware or stop it, but you want to get to the point where you're able to recover and be resilient in the face of these attacks so that it's not a major impediment, and just kind of say, that's unfortunate, we'll continue on. And that's where I want to see people get to.
So I just want to chime in. You mentioned bank robberies and how the numbers were comparatively low and 34 million and everything, except that you're talking stick a gun in the teller's face situation.
Absolutely, yeah, I'm not talking virtual.
Yes, but that's the thing, is why are you differentiating? Theft is theft. We've had rules about that for like 6,000 years. Just because you use a computer doesn't change it. There was a case a couple of years ago where some people got into the SWIFT transfer system, the Bangladesh
yes,
central bank, I believe it was Bangladesh, and had queued up $1 billion worth of transfers. The only reason they got caught was they couldn't spell the word foundation. But $1 billion could very easily have left, and that kind of throws your 34 million for a bit of a loop. So I just want to say that just because one type of incident doesn't happen as much doesn't necessarily mean that you're doing better. You've just now moved it to some other wheelhouse.
But the goal is, it's an illustration about risk management, and we have, at least in the United States, largely risk managed as you said, the smash and grab physical gun, sort of style of bank robbery. That has not mitigated where it has evolved, squeeze the balloon, it kind of pushes out to here. Absolutely, that's still a part of it and it needs to be managed and worked through. But, I want to see folks get to the point where, they say, oh, okay, it's a ransomware attack. Well, no big deal, because we've been prepared.
Jennifer, if you'd like to try that.
I mean, I do think the advanced preparation is a big deal. So, if we think about the current pandemic context, we're working with lots of long-term care homes across the country. And one of the promising practices is to say, okay, if you get your first positive test in your facility, who's that first call to and what response can you expect? And I think it's a similar kind of situation here. You want to have planned it out ahead of time. What is your approach going to be so that you're not thrown by that phone call? You know what supports you're activating. And, smaller organizations, and we're in that category, we're a relatively small charity. We need to have friends, right, who are in our virtual Rolodex should a situation like that happen, so that, there's people we can call, because we're not going to have all the expertise internally. And so, part of our plan is we have a place to go. And I think that pre-preparation is huge, just as it is in so many. And the good news in the health sector is that's familiar territory for so many other threats. So we need to apply the lessons we've learned in some areas to this one.
And you mentioned something I want to piggyback on. You mentioned advanced preparation and preparation. Where does awareness and training fit into this? And how important is it in the whole war against ransomware and pretty much anything cyber threat?
I think it's about half the battle. I mean, knowing is half the battle, G.I. Joe. But having the plan, because that's what both my colleagues have brought up, is incident response plan, knowing when things hit the fan, who to call, how to react. Do you have the equipment or special knowledge around to deal with this, or a quick phone call away? Because when everything's on fire is not the time to be evaluating, well, what kind of fire extinguisher do I need? And I mean, to go back to the original question about, if I was a person in charge of that, facility and it got hit with a ransomware attack, first thing I do is reach for the incident response package, probably a binder on the of my desk of here's what to do, here's what's going to happen, deal with the situation right then and there, to stop it in its tracks if you can, understand what the scale of it is, and have a recovery plan. After you've done all that, the second thing I would be doing is presenting all of the various emails and communications to management that warn them about this almost on a daily basis, that this was going to happen if they didn't deal with the problems that led to this, and hang that around their neck, and possibly send it to the evening news as well.
I think you're on mute.
Oh, of course. Thank you. Jennifer, how important is education in the organizations that you are part of? Like, do you put lots of emphasis on it? Like, do you have any resources organizations can tap into?
I mean, for us, it's certainly an important part of our internal lines of defense. And certainly in the work that I did with Healthcare Can, it was one of the very basics. And there are absolutely resources to tap into. And, I would encourage folks to access those resources, many of which are free or low cost. So it's not that you have to spend a fortune necessarily on some of that basic education. And I think that's a foundation. It needs to be updated too, right? It's not a one-time wonder. It is something that has to be continually reinforced.
Very true. Very true. Greg?
So I do want to take the opportunity to flag a few resources available from the U.S. government that are actually applicable across the board. We have, so my office's website, which is hhs.gov/HC3, has kind of up-to-date cyber bulletins, vulnerability notices, kind of warnings and things out there. There's also, if you Google, it's a horrible program name, but it's 405D. It's after a section of the law. We've got a bunch of cybersecurity best practices that we encourage everyone across the health sector to take care of and look at to understand their risk posture. And those are really good resources, and they're calibrated towards organizations of different sizes. I want to put to the question on education. Education is critically important, but I don't want to let the professionals off the hook and say that it's always an educational problem. And that is to say that, yes, users are part of this and they're part of the system, but it's on the system implementers, the system designers, the vendors that have systems that really aren't so dangerous and vulnerable to some of this stuff in the first place. And so I just want to put that plug in there.
And set up properly. There's the problem. You can buy that $100,000
exactly.
box and set it up in a terrible way that undermines everything.
Well, $100,000 box that is really difficult to set up properly, or someone says, oh, it requires time, and well, I just got it working. Yes, absolutely. Like, these things need to come out of the box in ways that it's not a Rubik's cube to try to get together in a secure configuration. So like, yes, the education is really important, but like the implementation, the design, and the security from the outset is just also super important.
Yes, that's great points. Like, I mean, an educated user is a vigilant user, and I guess that's what we want more of, people that are aware. Now, I want to piggyback on a question that Dustin asked about, and I probably asked Renderman on that one. How important is the segregation of systems? Basically, not having your email on the same servers as pretty much everything else. And if you can just touch on that a little bit, that would be great.
So segregation of systems is key to all of this. The idea that you have, delineations and essentially walls between portions of your network that contain, the super secret, or super privileged information away from the stuff that talks to the outside world. Because basically you have to remember, on the internet, you're 100 milliseconds away from every jackass on the planet, right? So you have this Mongol horde at the gates trying to get in all the time. And that's the thing that I think with ransomware that is sad and perverse, is that, yeah, it just takes one person clicking on a link, because the secretary's workstation also has access to all the health records. Like, why is that able to touch that server? That makes no sense. I've seen businesses that, from, any desk in the organization can touch stuff that has no earthly business being able to do. And it's just because a lot of times it's set up, it's just make it work. They don't have time to go back and actually set it up, or they know how to set it up right, but aren't given the time or budget to do it, or they're not able to go back and refine the implementation to set up proper VLANs and segmentation. Because again, it's if your defenses are a single layer and a single email gets through and is clicked on and everything gets encrypted, my sympathy for you is somewhat minimal. Whereas, if you've got somebody where they have to get a foothold onto something, move laterally into this other system, and then jump through this, it's like, okay, that I can respect a little more because you tried, as opposed to, a single paper thin defense and hoping nobody gets by. Security is like an ogre. It stinks, but it also has layers, to pick a line from Shrek. And you need to have those multiple layers of defense. You have to assume, okay, you do a penetration test, everybody pounds away at everything from the outside. Next step, continue that test saying, okay, assume you got in, what damage can you do? What can we do to mitigate that? And I think that's the step that a lot of people are forgetting, because that is not generally on a lot of the compliance checklists or requirements for testing. It's have you had an external scan? Well, what about an internal? Things like that are where I see the problem is.
In the remaining few seconds that we have left, if I can ask each one of you to just give one actionable item for folks to take away from this, what would that be? Jennifer, what would that be?
So Healthcare Can, which is a National Association of Healthcare Organizations, has a declaration on cybersecurity that organizations can take part in. It's 6 steps that you can commit to as an organization to set your foundation and be able to partner with others who are trying to do the same thing.
Thank you. Greg?
It's super important, if you have incidents, to share the information with kind of law enforcement, regional coordination groups, and others, because even though it might not happen immediately, it allows folks to take action in the long run and help increase the cost to these folks for doing these things. The other thing I want to say is just want folks to be prepared and not scared.
Thank you. Renderman?
Pizza and beer. Seriously, the best thing that you could do is, and obviously this example is assuming, a pre or post-pandemic situation, but taking pizza and a beer at 3 o'clock on a Friday down to the IT office, which almost inevitably is in the basement, sitting down with them and saying, what worries you? What they will tell you, oh, that box in the corner is, past end of life by 3 years, or this is barely holding on to the thing. Here's the things we'd like to do. they will have insights as to where the problems are, but understanding that they're never going to, they've got limited budget and everything, time, they're not going to be able to get everything. They just don't mention it anymore, or they stop mentioning it because it's a broken record. But sitting down and listening to where they're worried about, and realizing, okay, maybe we should make this a priority. That would probably be the best use, and for the cost of pizza and beer.
Thank you, everyone. Really appreciate your thoughts and your perspectives on this, and for sharing your time and expertise with all of us here. We really appreciate that, and I hope everybody managed to take away something from this presentation, from this great discussion. I know we could have gone for another hour at least, probably, but of course it's time to wrap these things up. So videos, including the video of this session, will be available on demand afterwards. See Dustin or Chris for more information on that. And I'll give it back to you, Rod, for wrapping up, I guess, day one of the PHIPA Summit.
Thanks, Simeon, and thank you to our panelists. It was a great discussion. I think the themes I took away build really nicely on the discussions we've had earlier today about think holistically. So as privacy leads in your organizations, you don't have to be the IT expert, but you better know them well. And I think that's the message we heard from Renderman. I think you got to think holistically. It's people, processes, technology. And the bad guys only got to get through once. You got to protect your environment 24/7. So the odds are challenging, but do what's reasonable in the circumstance. Will an external agency organization looking at what you did say you did what you could? And that, I think, is an important message to say, because we are all time and resource constrained. At the end of the day, learning from each other is one of the great assets, free assets. What's going on in real time, and staying connected to what's happening to your peers so that you can minimize the impact, right? So training, I think the idea of staff awareness and training is incredibly important, but it goes hand in hand with knowing what your technological environment is set up to do, and the idea of defenses in depth, right? It's going to happen where level 1 gets breached, level 2 gets breached, segregating your data. You're trying to make it difficult for the bad guy to get into your environment. They may still get into it, but they'll go after the easiest targets first if they're trying to monetize. So I think I've heard a lot of great insights and lessons from our day here, and certainly thinking forward, trying to look at frameworks that help you as a privacy officer consider some of these cybersecurity related elements, and using a risk framework. There are resources abounding both in the US, in Canada, that are reasonable for the non-professional, the leadership decision makers to follow, that makes sense. You don't have to be a NIST expert or ISO expert and read these very granular, very difficult to read standards to understand what you need to do to plug the most obvious holes in your work environment. But then always plan for when it happens, what do we do, right? That taking that reaction approach, minimizing the time to response, the impact on those clients who are in fact trusting your organization to protect their information at the end of the day. There's lots of research that will say people will accept an oops and I'm sorry, as long as you can demonstrate that you are plugging those holes going forward. It's like a quality improvement approach. And when you see some of these massive companies, the banks, the Sonys of the world, the Equifax, how do you expect to be able to measure up to that level of sophistication? We can't. So we have to do what's reasonable to maintain that trust of clients that come to your organizations for services with very sensitive issues. It's going to happen. How you respond as a leader and how you help prepare your organization is really the challenge in front of us. Now, going into tomorrow, we've got a very exciting day ahead of us. We'll be hearing from the Information Privacy Commissioner of Ontario. She's new in her role as of July, and I've had the privilege to sit on a strategic advisory committee to help set the next 5-year strategic plan for the IPC. And it's fascinating, the dialogue we're having around what is the role of the IPC in relation to Ontario government as a regulator, and looking at the changes to the privacy legislation. It's a shifting landscape out there, which creates opportunity as much as potential risk, right? And then we'll have the opportunity to speak with the Ministry of Health Director Christine Sham from the Information Management Strategy Branch. So I know in one of our breakouts, we said, where is the government at around helping to standardize privacy and security practices, et cetera? So we'll have an opportunity to ask Christine that. She used to work in primary care. She's now leading information management strategy and policy, informing the go forward for policy. So it'll be a very interesting day tomorrow. So with that, it's 4:30. I am going to draw today's session to an end. Once again, thanks to our panelists and all of our speakers today.